Hello. In the next few weeks, I am going to be taking you through the cardiac disorders. There are 4 of them. I'll be doing coronary artery disease. I'll be doing myocardial infarction, that is MI. I'll be doing heart failure, and I'll be doing cardiogenic shock. But for today, I will start with heart failure. And then in the coming weeks, that is going to be covered in the course of this whole month. I'll be doing the rest of the remaining 3. So please be tuned to learn. These are good courses, especially for the nursing students, for the nurses who want to keep up with things they forgot. Begin to learn today. In layman's language, if somebody asked you what heart failure is, what would you say? So separate the 2 terms, heart and failure. That means this is a heart that has failed, a heart that is failing, right? So let's dig into it. Like a universally acceptable answer would be, the inability of the heart to pump adequate blood, in order to sustain, the metabolic needs of the body, right? And this subsequently, leads to congestion in the chest or the peripheral congestion as well, and we're also having pulmonary edema, right? So heart failure is actually categorized into 2. We are going to be talking about right-sided heart failure, and then we're going to be talking about left-sided heart failure. But I would prefer that we start with left-sided heart failure. That is usually so quick to catch on. It's very common. Before we dive into the signs and symptoms and all that, I want you to understand that, left-sided heart failure and right-sided heart failure, they both have symptoms that are really different, and these are the symptoms that are actually examinable. These you're going to find them in exams, or just in your patients. You're going to find this even in your patients as you work in the wards. This is actually something you're going to find. So let's begin with the left-sided heart failure. So in the left-sided heart failure, as we had previously mentioned, this is the most common type of heart failure, right? It is divided into, it has types, 2 types. There is diastolic left-sided heart failure, and then there is systolic left-sided heart failure. So let's talk about systolic left-sided heart failure. In the systolic, we have an issue with the ejection fraction. We know that the ejection fraction, the normal ejection fraction is 50 to 70%, right? But now in the systolic one, it is either 50 or slightly less than 50. Okay, and then here the heart is too weak to pump out enough blood. In the diastolic, which is also called left ventricular diastolic dysfunction, the ejection fraction of the heart is normal, it's within 50 to 70, but the heart actually is too stiff to receive any blood. So I hope you've noted the 2. Let's just dive into the signs and symptoms of left-sided heart failure, and for that I'll need you to write an acronym. Just write it down like I've done on my screen. Write drowning, where D stands for difficulty in breathing. Then we have R, those are the rails or crackers. So if yours started this patient, that is what they're going to be presenting with in the in the chest. O, we have orthopnea. W, we have weakness generally. So they have generalized body weakness. Of course, if you're not getting enough blood, there's little tissue perfusion or close to none, you understand? So there's generally going to be weakness. Then we are talking about N. N is just nocturnal paroxysmal dyspnea. This is where you find the patient is having difficulty in breathing at night, and these episodes really are in the night. The I stands for increased heart rate. So the normal ranges of a heart rate being 60 to 100. So we are expecting that this heart rate is over 100 plus. All right. So that was I. Then we are on N. N is the nagging cough. Now let me tell you something about the nagging cough. It's also very rampant in the night. It's like the difficulties in breathing. They are so rampant in the night. And then G, which is the final letter of this acronym, is going to be gaining weight. When you look at them, they've generally gained weight. Of course the heart is not functioning properly. There's a lot of fluid retention. So that is just that. So let's just dive into right-sided heart failure. We are talking cor pulmonale. anytime you get a term that cor pulmonale, as I've put it on my screen, that's just right-sided heart failure. We are talking congestion in the hepatic sac. We are talking about the body swelling, literally. And as we did on the left-sided heart failure, we're going to do on the right-sided heart failure, so that the signs and symptoms are actually so easy for you to catch on, right? So we're talking about the body swelling, so just write the acronym swelling there. Also, starting with the letter S, we've just talked about swelling. So everything in this patient is swelling. So they have swollen abdomen, the liver is swollen, that is hepatomegaly, the hands, the lower limbs. Now, then these patients also have weight gain. In the E, they have enlarged neck veins. Okay. These are usually so hard to miss. You can literally see the neck is so the neck veins here, they're usually so distended. It's so hard to miss that one. Besides that, they have edema, which is pitting. Then they are lethargic, and then they have irregular heart rate. The bad side to this, or the downside to this, is that, you know, with the irregular heartbeat, this patient is likely to get AFib. Okay, AFib, atrial fibrillation. That is a topic for another day. Again, they do have nocturia, and the girth of the abdomen is just generally increased. Okay, I'm hoping that you are able to differentiate the signs of symptoms of the right-sided heart failure and the left-sided heart failure. So in the left-sided heart failure, we are doing drowning. In the right-sided heart failure, we are doing swelling, right? At this juncture, we're going to talk about the nursing interventions. Remember, we will never intervene on a patient without doing our assessment. So what are we assessing at this time? We are assessing for signs of worsening symptoms, you know. We're also assessing for patient responsiveness to medication. And let's just look at these medications that are usually used in this. We are talking digoxin and sometimes vasodilators. Mostly, you're going to get vasodilators. So when you're administering digoxin, what is so keen to look at? The pass rate, right? As long as the pass rate is less than 60, what do? You do not administer that drug, all right? You don't administer that drug. So if it's 60, it's safe to administer. So if we are going to administer the vasodilators, what are we keen on? We are keen on the BPs, right? Because if the BPs are quite low, we are likely to hold that medication or consult the doctor about it. Why? Because vasodilators cause hypertension, right? They cause hypertension. So you have to be keen on the BPs before you administer any vasodilator. Then you're talking about administering diuretics, because mostly they edema, right? What are we supposed to be keen on when we are administering like diuretics? Do you remember that? Do you remember? We have to be keen on the potassium levels, okay? So we need to have our electrolyte panel with us before we administer any diuretics, because of the risk of hypokalemia, right? So be keen on the input and output. We do not want to overhydrate this patient. We do not want them to stay dehydrated. So input and output is actually key. Remember, these patients, again, they have fluid restrictions. It's really important for you to know that and be keen to know what they are getting in a 24 hours chart. We need to place this patient on cardiac diet, right? So you need to consult with the nutritionist. And of course, we are going to be monitoring the edema status. It's good to know if the edema is subsiding or it's not subsiding. So we inform the doctor of what is going on with this patient. So in that line, do you remember the classes or the stages actually of heart failure? Please do your memory and get yourself to remember. So in stage 1 or class 1, you don't have any symptoms during the normal physical activity, right? But in stage 2, you're comfortable at rest. At rest, you're really okay. But during the normal activity, you develop symptoms. In stage 3, you are comfortable at rest, but minor physical activity brings you discomfort, yeah? In stage 4, any physical activity brings you discomfort. Whether it's minor or it's normal, it brings you discomfort. And this might apply even when you are at rest, okay? So the diagnostics, what do we usually do to diagnose heart failure? And by the way, before I forget, the classes of heart failure are really important. for the physician or the cardiologist to help know the management to take, you know. Now, of course, we're going to need, for the diagnosis, we're going to need the ECG, we're going to need the echo. Those are the most common. You would never miss that. And definitely, a chest x-ray is also okay. Blood works are not so common in this, but, you know, they'll be so common in the MI. Well, if anything, if the blood works were to be used in this, it would be actually to rule out any other condition. Okay? So this is the end of my video, guys. If you have any questions, please be keen to ask me down below in the comment section. Also tell me if you enjoyed the video, if you learned something. Again, I'll be attaching a quiz. This will only be applicable on YouTube. You understand? TikTok cannot really, I don't know, I have tried on TikTok, but it just, I don't know what happens. The links are not really openable or something in that line. So on YouTube, it's still Muthoni William. Go in on this video still and try to do the quiz that will be there. Okay? Guys, have a good day from wherever you are. See you in my next video. We'll be talking about MI.